Good morning, students. Today, we will be discussing the fascinating and crucial topic of traumatic brain injury and its various radiological manifestations. Head trauma is a common occurrence in both clinical and emergency settings, and understanding the mechanisms, patterns, and imaging modalities for diagnosing and evaluating these injuries is of utmost importance. Throughout this session, we will cover 12 specific topics, each highlighting different aspects of traumatic brain injury. So, let's dive into our first topic. In this section, we will discuss the different mechanisms of head trauma and their patterns on imaging studies. Falls, road traffic accidents, assaults, and sports-related injuries can all cause varying types of injuries within the brain. Understanding these patterns is vital for treatment planning and prognosis evaluation. Intracranial hemorrhage, or bleeding within the skull, can occur following head trauma. Different types of bleeding include epidural, subdural, subarachnoid, and intraparenchymal hemorrhages. CT scans are best for initial evaluation, while MRI provides detailed information about location, size, and complications of the hemorrhage. Understanding the capabilities and limitations of each imaging modality is crucial for accurate diagnosis and management of patients. In the fourth topic, we will discuss the management and treatment options for epidural hematomas, including surgical intervention and observation. Additionally, we will explore the potential complications and long-term outcomes associated with these types of head injuries. Subdural hematomas occur between the dura and arachnoid mater. They result from torn bridging veins, leading to blood accumulation. Their shape on imaging can vary, with acute hematomas showing high density and signs of pressure. Subacute and chronic hematomas may have lower densities due to blood degradation. In our sixth topic, we will discuss the management and treatment strategies for traumatic subarachnoid hemorrhage. We will explore the different imaging modalities used to diagnose this condition and how to differentiate it from non-traumatic causes. Intracerebral hemorrhage refers to bleeding within the brain parenchyma. It can occur due to direct trauma to blood vessels or as a result of shearing forces causing vessel rupture. On imaging, intracerebral hemorrhages appear as hyperdense lesions on CT scans. The location and size of the hemorrhage can provide valuable information regarding the underlying pathology and prognosis. Additionally, MRI imaging can help assess the extent of surrounding edema and provide insights into the underlying cause of the hemorrhage, such as contusions or underlying vascular malformations. Now, let's proceed to our seventh topic. In this video, we will cover intracranial hemorrhage, which is bleeding within the skull. It can be caused by traumatic brain injury or other medical conditions. There are various types of intracranial hemorrhage, including epidural, subdural, intraparenchymal, and subarachnoid hemorrhage. Each type has specific imaging findings that aid in diagnosis and treatment planning. On CT scans, epidural hematomas appear as a lens-shaped blood collection between the skull and the outer layer of the meninges. Subdural hematomas present as crescent-shaped collections between the inner layer of the meninges and the brain. Intraparenchymal hemorrhages are localized bleeding within the brain tissue, while subarachnoid hemorrhages involve bleeding into the cerebrospinal fluid-filled spaces around the brain. MRI provides additional information on the extent, location, and complications of the hemorrhage. Pneumocephalus refers to the presence of air or gas within the intracranial cavity, often resulting from a skull fracture or neurosurgical procedures. It can lead to potentially serious complications such as infection or increased intracranial pressure. On imaging, pneumocephalus is readily identified through imaging modalities such as CT scans, which demonstrate the presence of air within the cranial vault. The location and amount of air provide valuable information regarding the source of the air, the risk of complications, and appropriate management strategies. Now, let's proceed to our ninth topic. Skull fractures are common manifestations of head trauma and can provide valuable insights into the underlying mechanism and severity of injury. On imaging, skull fractures are typically seen as disruptions or breaks in the normal continuity of the skull bones. CT scans are the preferred imaging modality for identifying skull fractures due to its ability to visualize bony structures with high resolution. The type and location of the fracture can help determine the risk of associated intracranial injuries and guide treatment decisions. Now, let's delve into our 10th topic. Brain contusions are focal areas of brain injury often seen with direct blunt trauma. They result from the brain colliding with the bony inner skull surfaces, causing tissue damage and bleeding. On CT scans, brain contusions appear as hyperdense areas with surrounding edema. The distribution and extent of contusions provide valuable information regarding the impact of the injury and potential involvement of critical structures. MRI can offer additional insights into the contusion's age and associated complications, helping guide patient management. Now, let's move on to our 11th topic. In the 11th section on cerebrovascular edema, we discuss how brain tissue swells due to trauma, causing increased pressure and potentially life-threatening complications. We explore how imaging, such as CT and MRI scans, helps identify the extent and causes of edema, allowing for effective management and improved patient outcomes. Radiological grading scales are essential tools for standardizing the assessment and communication of traumatic brain injury severity. These scales aid in prognosis evaluation, comparing treatment outcomes, and conducting research studies. Various grading scales are used, such as the Marshall classification, the Glasgow Coma scale, and the Rotterdam CT score. Each scale evaluates different aspects of traumatic brain injury, including the presence of fractures, hemorrhages, contusions, midline shift, and level of consciousness. Radiologists and clinicians rely on these grading scales to guide treatment decisions and prognostic discussions. To effectively diagnose and manage head trauma and intracranial hemorrhage, it is crucial to comprehend the radiological aspects. Knowledge of different pathologies and imaging techniques is vital for patient care and advancements in this field.